Thanks so much for being with us. With the Moderna and Pfizer vaccines now approved and being administered, the Centers for Disease Control is looking at who should be part of the next phase of that distribution. Right now, it's healthcare workers and residents of long-term care facilities. Our Ryan Jenkins reports a state health department vaccine subcommittee is now working to determine who will get it next.
Looking ahead to phase 1B of vaccine allocation, the state vaccine subcommittee is really focused on who in this next group should be the first to get the vaccine.
We need to make those hard decisions given the small amount of doses of who gets the next slices of pie.
Pfizer's vaccine is making its rounds. Moderna's vaccine was authorized by the FDA Friday, and the CDC has issued some new guidance on who should be among the next to receive the vaccine nationwide, determining frontline essential workers like police, firefighters, teachers, postal workers, grocers, and public transit employees should all be among the next to receive a dose, as should people 75 years of age and older.
The more vaccine that actually gets into human beings, mounting an immune response is, I think, in many ways, the ultimate goal.
Now, the State Disaster Medical Advisory Committee's vaccine subcommittee is meeting to determine how to allocate doses to that next group. At times, risk factors such as age dominated their Tuesday morning meeting.
If we want to save lives, we've got to give the vaccine to the people the virus is killing. And the virus is killing older people.
Focus on death is one thing, and preventing deaths is always a noble goal, but there's more than just death, and people are seeing it. Young people are having strokes, they are losing limbs.
Other doctors suggested race and socioeconomic factors be prioritized, especially in places where those risk factors seem to be having more devastating impacts.
I think it is fair that we give preference to these populations, especially in Milwaukee County. I do not know how extrapolatable this is to the rest of the state, but here in Milwaukee County, it has to be just as important as age.
The discussion is still preliminary. Eventually, the final recommendations will make their way to vaccinating entities. And as this group works towards that final recommendation, phase 1A, healthcare workers and those in long-term care remain the vaccination priority here in Wisconsin. Reporting in Milwaukee, Ryan Jenkins, TMJ4 News.